Good morning, everyone. Lovely to have you. Thank you for joining us today. We'll just wait for a few more seconds for participants to join. Okay. So, good morning, everyone. Thank you for joining us on this autumnal weekend morning. It's a pleasure to have you. Let me begin with a few housekeeping notes. This session is being recorded. We will have a talk by Dr. Julieta Galante and then a Q&A session. Please submit your questions during the webinar using the Q&A button at the bottom of the screen. And we will do our best to address as many audience questions as possible, but we may not be able to answer all of them. And this is being recorded and will be uploaded onto our YouTube channel or SoundCloud. So I'm delighted to welcome you here today to our talk on Can Mindfulness Really Help People Thrive? By Dr. Julieta Galante at the University Department of Psychiatry. And this event is hosted by the alumni group Mindfulness Cam, which is myself, Corinne, and Harriet. So Julieta is a qualified medical doctor specializing in public mental health research. For over a decade, she has been winning competitive funding to study the potential of meditation techniques for mental health. Her research uses rigorous methods in real-world scenarios and has been featured in international media outlets, influenced policy, and presented to a wide range of audiences, including UK members of Parliament. With other colleagues, she conducted the University of Cambridge's pioneering mindfulness trial in 2015, and the results of which she will share with you today. So this is actually a two-part seminar where we follow Mindfulness After Cam will follow this talk on the benefits of mindfulness with a guided meditation by the university practitioner, Dr. Elizabeth English. For those who have not signed up but would like to attend, please let us know at the end of this talk and we can share the link with you. It's 10 till 11 a.m. So without further ado, it is my great pleasure to introduce you to Dr. Julieta Galante, whose work has been pivotal and meaningful in improving mental health through mindfulness. Julieta.
Thank you very much. Thank you, ladies, for inviting me. And I will share my screen now. Is that okay?
Of course.
Right. Okay, let me just see. Great. So can you see the slides then? Okay.
Yeah, that's all great.
Excellent. So you have already introduced me. Thank you, everyone, for waking up on a Saturday morning to hear about mindfulness. So I'm going to start straight away. Let me just see how to, how to progress with the slides. If you're here, you may know what mindfulness is, but I don't want to take it as assume everyone knows. So what usually we think of as mindfulness in these mindfulness courses that I'm going to talk about, which are the typical one you hear in for instance, here in Cambridge University, is sort of a set of mind training techniques. So it's mindfulness training, and the idea is to learn to pay attention to what is happening at the present moment with a specific attitude of curiosity and kindness. This is a definition given by John Kabat-Zinn, who created the MBSR, mindfulness-based stress reduction course, around 1979, I think it was the date he created this. So this is a definition that most of the mindfulness courses nowadays are using. Now, You may have heard that meditation now is $1 billion business. It's everywhere. I don't know if you have seen it, but it's in universities, and as I'm going to explain. Courses are also being offered in private companies to employees, in civil service departments, in many places around the world, not just in the UK, in the US, mainly actually, even more than in the UK, and even in the military. So it's really permeating all the sectors of society, this offer of meditation, particularly mindfulness courses. Many times mindfulness is compared with physical exercise, and it's some people say you should be doing it every day. You should be, everyone should be doing it. It's like a fundamental capacity that everyone should cultivate, and it's in that sense like physical exercise that everyone should do. I have a Q&A. I'm not going to pay attention to that, right? Okay. Yeah, people are asking, and that's great. We're going to do the Q&A later, but keep asking questions. That's totally fine. So this is what the NHS website says about physical exercise. So look at this, step right up. It's the miracle cure we've been all waiting for. It has, well, all these benefits: lower your risk of early death by up to 30%. It's free, easy to take, has an immediate effect, and you don't need a GP. It's named exercise. So my question here is, are we there yet with mindfulness? Could mindfulness help everyone thrive in the same sense that physical exercise can help everyone with their physical health? And actually, physical exercise can help everyone with their mental health as well, as you probably have gathered in the during the pandemic and the lockdowns. So yeah, so I'm going to focus on this, on mindfulness as a tool to prevent, and how far can we stretch the comparison, excuse the pun there, between mindfulness and physical exercise. So I'm going to talk about two studies, but I'm going to focus mostly on this one, the Mindful Student Study. This is a study that Isabel was referring to initially, which happened here at Cambridge. And perhaps some of you were even participants or heard about it when you were studying here. So what's the context for this study? Student mental health has been a big topic, and it has been in the headlines. You may have seen in the news that lots of people are concerned about the mental health of students at universities in the UK and also elsewhere. So here in the UK, the concerns are exactly mirroring those big news in Cambridge, with, for instance, the UCS. The UCS is the University Counselling Service. The UCS has noticed that the referrals increased by 62% in 10 years, and they are at the level of 11%. So 11% of the students are being helped by the University Counselling Service at the moment, and that has been a major increase for the last 10 years. What also increased a lot is the disclosures of mental health problems, that should say problems, that increased by over 4,000% in 10 years. So this is all having to do with, of course, concerns about students' mental health and also about capacity. The university has a duty of care, but their capacity to attend to all these problems is also challenged. So this was in 2015 when we started the study, and basically the idea was that the University Counselling Service was looking for an intervention that could be effective, could be cost effective, but also that could be popular, that students would actually attend. And they noticed, they did a few mindfulness sessions, and they noticed that mindfulness was being really popular, that students were really interested in this. So what they thought at the time was, well, let's increase the provision of mindfulness and let's do a pilot. Let's increase the provision for 3 years, and let's see how it goes, offering it to hundreds of students, even a term. And also because, you know, we're a research intensive university, let's do some research, let's see if it really helps. And if so, we may fund it for the longer term. So this is where Dr. Elizabeth English, who you will meet later, hopefully, comes in, and she was hired to actually develop these mindfulness skills for students course and to deliver it. The course, well, she would be able to tell you much more, but I'm going to do a little summary. So this course was developed independently by her, meaning that the researchers had nothing to do with the development of the course. And this is important for keeping the bias low for the researchers. And so, but Elizabeth, basically, she used this book called Mindfulness, Finding Peace in a Frantic World by Mark Williams and Danny Penman, and she adapted the course for students. But basically, it was 8 sessions of around an hour and a half each session, weekly sessions, plus some home practice, mindfulness meditation practice, and some informal exercises like mindful walking or doing other tasks in a mindful way. This course was delivered 7 times in parallel per term, and each course had 30 students each. So you can see that this is a significant provision for students here at Cambridge. And also, aside from the course, she was offering a few minutes at least of one-to-one support. So this is important because it adds to the nature of the course has to do within the results that we're going to see with the effectiveness, and any of these elements could influence that. So for the research part, what was the research question? What did we wanted to know? What was the main thing that Cambridge needed to know from this study? And the main thing that we identified was that they wanted to know if the provision of mindfulness training would reduce students' psychological distress during the exam period, in particular, which is the most, as you probably know, the most stressful time of the year for students. And they wanted to know if this provision would be better than not offering this provision, basically. So that would be the comparison group. What did we do? So this is the design of the study. We did a study called Pragmatic Randomized Controlled Trial. What does it mean? This is pragmatic because it's in real life, so we didn't change the way things would happen if this wasn't a research project. And randomized controlled trial because we randomized the students who are interested in participating to receiving mindfulness or to being offered the mindfulness course in that same term, or having to wait for a year in order to receive the mindfulness course, basically, or to not receiving it and to just have the usual offer, of mental health support that you would find in the university aside from mindfulness. This study was done in collaboration with stakeholders. What does it mean? It means that the researchers listened to what the people who needed the results really wanted, and also to the people who would be the beneficiaries of the results. So the stakeholders, such as, for instance, students. And here you can see Beth. She's one of the students who was involved in the study and helped us to actually design and run a study that was friendly to students and useful and acceptable. And you can see her meeting our study mascot, Dr. Alstein. So the population, everyone in Cambridge, all the students were invited, and we advised them not to take part at that time if they were undergoing a severe mental health condition or crisis. The control group, I told you, and the main outcome. So what did we measure during the exam period? We measured psychological distress, which is sort of the bad phase of stress. That one that is not really enjoyable at all. And the tool that we use is a questionnaire. So it's a self-reported questionnaire called CORE-OM. We recruited over 600 participants for this trial, and as I said, randomly allocated them to mindfulness or to mental health support as usual. The students that we recruited, or that is actually the students who decided to volunteer themselves, we found that they were at-risk students, which is interesting. So they were, their well-being and their distress was higher than the typical student in the UK, but it was lower than the typical student in the UK who is being treated at a university counselling service. So it's in the middle. So that we were really interested in that. We were happy to see that, because it means that we may be targeting those who really need some support in order not to fall into the category of needing treatment or needing extra support. Most of the participants were women. This is very common in psychological research and in mindfulness research. And the sample was representative in terms of ethnicity and disability, which was also a good thing, because it's harder to get representativeness, particularly with ethnicity in psychological research. There's usually an over-representation of white backgrounds. So there were people who were randomized to mindfulness. 60% of them attended half of the course. We didn't influence that because I said it was a pragmatic trial, right? So people could do whatever they would normally do with the course. And then we asked them to complete these questionnaires as soon as the participants in the mindfulness group finished the intervention, and then during the exam period, which happened a few months after finishing the course, and then after a year. And you can see that in spite of several reminders, it was really hard to make everyone answer these questionnaires. And so we had what we call loss to follow up. So we had people not answering our questionnaires after a certain period of time. This limits the validity of the results, actually. So this is the results, and you can see there. CORE-OM, as I said, it's the measure of psychological distress from 0, which is no stress, to 3, which would be the maximum distress. And then you have the blue line representing what happened with the control arm, with the mental health support as usual throughout the year, and the red line for what happened with the intervention group, the mindfulness group, throughout the year. So the first what it says baseline, that's when they were recruited. You can see that they were roughly similar, which is absolutely normal for this trial, because they were randomly allocated to the arms. Then T1 would be right after the intervention group finishes the mindfulness course, and you can already see a difference there, which is statistically significant. It doesn't seem to be a big difference, but it's statistically significant. And then during the exam period, this is where the difference got bigger, with the control group becoming more stressed and the mindfulness group being able on average to retain the level of distress, a lower level of distress that they were having already. So basically they didn't seem to get more stressed because of the exams. And then after a year, when it's still significant, the difference, but it became smaller again. This is another way of seeing the results, and this is specifically during the exam term. So what did we do here? We dichotomized the scores, the distress scores. We said, well, okay, certain scores are above what we call a cutoff point, and they basically mean that the person scoring those levels of distress would be in the clinical range of distress, would need help from the counseling service. And the people scoring below that, they wouldn't. And so we looked at how many people were scoring above and below during exam term in the different arms of the trial. And we see here that in the control group, 60% almost were scoring above the clinical cutoff point. And these are people who are studying for the exams, this is not a population that has mental health problems necessarily or anything. So this is quite concerning in terms of the mental health of the students when they are revising for exams. And mindfulness was able to help. As you can see, only 37%, which is still quite high number, perhaps for the amount of students needing help. And this is a different outcome, and this is a secondary outcome, and it's an exploration. So it's not very reliable, but it's an interesting slide I wanted to share with you. So this is the results of the exams of that exam term, and this is divided by among the mindfulness and among the control group students. You may be seeing already that mindfulness students got more first-class results, and then also more third-class results. So it's not a straightforward relationship between mindfulness and performance. This is what we see here. We cannot conclude much more, and these results would need to be replicated and studied, and it's not easy to do this. But it's interesting to remember that not necessarily because someone feels better, because we know this, that the mindfulness students clearly were feeling better than the control students, but that doesn't necessarily translate into better performance. It's much more complex than that. Well, this is about how much the students in the different arms used the university counseling service. So we can see here that the mindfulness group used a bit less of the counseling service throughout the year. This is throughout the follow-up year, and this is complete data. But this was not statistically significant. However, when we look at the sort of support that they needed when they contacted the UCS, whether they needed high intensity support because this is an indicator that their situation was probably severe, or medium or low intensity support. And here we see that actually the mindfulness group needed support of the less intensive nature, which also is encouraging. It's good news. Okay, I've been talking a lot about students, and I would like to talk a little bit about what happens beyond university students, to go back to our initial question about whether mindfulness would help everyone thrive. So after doing the trial, we thought, well, how about the other populations? And we asked the question, what is the effect of these mindfulness-based programs, always talking about in-person programs, for promoting mental well-being among adults living in the community compared with no intervention, or also with other programs. And instead of running a trial this time, we looked at other trials, because there are lots of trials out there. And so what we thought is to actually look at the evidence that was there. So we looked at 136 trials from 29 countries, and these were the things that we were studying within those trials: psychological distress, the same outcome as before, depression, anxiety, and well-being. And what we wanted to see is what happened with these between 1 and 6 months after completing the mindfulness program. Not just immediately, because sometimes that's more biased, the assessment that you give just after finishing, but the assessment after a while, after it, things were settling inside, and see whether the program has been successful or not, more in the long term, in the longer term, not even long, but longer. So what did we do? We did a systematic review and meta-analyses. This is a sort of summary of summaries, I call it. So the data from each study, as you see there, data one would be from one trial, like the one we conducted here in Cambridge, I talked about before. So let's imagine that each of those blue squares are, one participant. But then you have other trials. Data 2 has other participants, data 3 others, and data 4. So these are 4 trials. Each trial will publish a paper like we did, and that paper will have summary data. So for instance, the mean of the effect, right? among all those participants. So all that information is summarized. And the same with all the trials. And what you do in a systematic review and meta-analysis is you search for those trials really carefully and in a transparent and reproducible way. You search for those papers, basically, for the summaries. And then you extract the summary data, the mean and all those other statistics from the papers. You extract them and you summarize them again. So you take those averages, those means and those averages, and you average the averages in specific ways to obtain sort of a mean of means, which is a bit more complex than that, but that would be the idea. And you also look at the uncertainty around that. How sure are you? How reliable, how precise are these estimates of what you think happens out there, right, with the rest of the population represented in this trial? So these are the results. We looked at 3 comparisons. So mindfulness courses compared with not doing anything in particular. So for instance, our trial was in that category. Then we looked at mindfulness versus doing something, but something that is not specifically to improve mental health. So for instance, reading a novel. And then we looked at the trials that compared mindfulness with an intervention that is also aimed at improving mental health, so such as, for instance, I don't know, relaxation course. So these are the results here, comparing mindfulness with passive control groups. And you have, in each line, each outcome and the numbers of trials that were summarized for that outcome that measured that. And then you have this line, this little figure here with a vertical line. So everything to the right of the vertical line means that the mindfulness course was better than the control group at that outcome. And anything on the right is the opposite, right? So those bars are the effects. The blue color would be the mean effect, right? More the estimation that we can make about the mean effect. All that range covered by the blue. So this is, on average, for the average person, what we think would happen. Would the mindfulness course improve anxiety compared to the passive control groups or not? So for instance, we see that yes, that it would. It doesn't touch the line. But then the gray bars are what we think would happen, or what we think happens. 90% of the cases, we also have these levels of certainty in the different contexts that are represented. So this is not the average. This is what would happen in trials. So the trials measure slightly different things, right? Within anxiety, some of these trials were done on pregnant women, some on police officers, some on general people from a specific community in different countries, and slightly different mindfulness courses and this sort of thing. So they are more or less homogeneous, but not entirely homogeneous. So there are differences, there are different settings and contexts. So what we see here in the gray line is what we think happens, what the range is of the effects for all the different contexts represented in those trials that we included. And what we see here is that in some contexts, mindfulness may not be necessarily beneficial, right? This is what we see when the gray bar touches or crosses the vertical line. When the gray bar crosses the vertical line. And we can see here then that on average, mindfulness is great, but we cannot really generalize that to all the settings that were studied in the review. So this is for the active non-specific control groups. We see, this is what I said, like compared with reading a novel. We again see that for anxiety and depression, mindfulness is on average clearly beneficial, but we're not really sure. And for well-being, there was just one study, so that doesn't really count. And for the comparison with other things that you can do for your mental health, including physical activity, actually, we don't really see huge differences. actually we cannot be confident that mindfulness will be better than other interventions. Okay, the other thing that we measured in this review is the quality of the trials, because the higher the quality of the trial, the more confident you can be in your results. So we had all these trials, and we used a tool that is, again, transparently analyzes the risk of bias. We say, more risk of bias of a trial, less reliable the results. Still, we're talking about randomized controlled trials here, so it's kind of a really thorough design to answer these questions. But within that thorough design that we're using, there are different qualities, as with everything, right? So higher the quality, more confidence. And we can see here that the quality was not really very good. I mean, the red here shows you that there could be biases here, and some of them are unavoidable, completely unavoidable. Like, we're using self-reported outcomes. How can you measure psychological distress or anxiety or depression? It's many of these things are really basically you reporting this, right? There is a biological correlate, but the core of it is how you feel, how you subjectively feel. So, those things are going to generate bias, but are unavoidable, the nature of this research. And some of them are avoidable, so the field needs to mature really and design better trials in order to be more confident in the results. And also, and last, most of these trials have not measured any other thing than the kind of the positive effects that they were expecting. And this also is something that needs to mature in order to have a clear view, because we have seen now that for some context, mindfulness may not necessarily be beneficial, but on average it will. So we need to understand better which context is better for whom, and the interaction between your characteristics and your setting and the type of mindfulness course that you are going to do, and how will that affect your mental health. This is a reference from another trial that I conducted. Actually, it wasn't a mindfulness trial, it was a different meditation intervention, and it was an online trial, and we were offering participants to write about their reflections in an online diary, which was quite anonymous, the diary. And we found some participants reported repeatedly this sort of thing. For instance, that in the first video session, the first meditation session that this person did, she was mildly shocked to find herself crying at the end and didn't really understand why. And that made this person quite uncomfortable. So this is not a very severe unwanted effect, but it is perhaps more frequent than when we think, and we need to develop methods of measuring these things properly as well. And then there are some reports of more severe effects, but really this research is only starting, so there's a lot to be done to understand what's best for whom, and I'm doing a little bit in this area now. So, conclusions. Mindfulness training can be an effective means to promote mental health. Yes, we have seen that on average, there's good evidence for this, but we cannot assume that mindfulness works for everyone, everywhere. So we need to be careful, and we need to continue doing research. And also, let me just say, this applies to in-person courses. So I'm not covering what happens with apps and with automated courses. This is courses where there's a teacher in front of the course. We're not there yet as with physical exercise. So physical exercise has an incredible amount of research behind it, and we know exactly, or pretty much exactly, what type of physical exercise each person should do, and when they shouldn't do certain things, and how much, and what happens in the long term. If you do like 30 years of physical exercise, how that compares with other things. There's more research about physical exercise and about many other interventions, and this applies to mindfulness as well. And we need to understand what's best for each person in terms of also using other interventions. So this is called comparative effectiveness research, and we need to do more of that as well. So I will stop here, otherwise there won't be time for questions. This is the team that has been behind all this. It has been a wonderful team, and as you can see, quite a lot of people behind all this research. I didn't have time to mention names or other studies that were around this study, so it was a very restrained account of what we've been doing here. Thank you very much. I will stop sharing now.
Thank you so much, Julieta, for the really interesting talk. And thank you everyone else for submitting your questions. Got lots of interesting questions in the box, but if you have any more, feel free to keep them coming in. So I guess we'll start with, you said that mindfulness might not be helpful for everyone, and you need to look at context. So did you have any look at the mindfulness effectiveness correlations with other factors? So for example, gender, ethnicity, social situation, or financial?
Yeah, this is a great question. This is exactly what we're going to do now. So in order to do that, it's very hard to do that looking at just summaries. So as what I explained, that we look at the paper, we look at the mean. So in order to do what you're saying, basically what you need is to access the individual participant data for each trial, because each participant will have a different gender, a different education level, and so on. So what we're doing now is putting together a collaboration of many of these trials, of the best quality ones. We're putting together a collaboration to share the individual level data for each trial. And yeah, we're already having data for about 10 trials and starting to analyze that. So that's the next step.
Thank you. You mentioned about the university counselling service. Can mindfulness help in cases of mental illness? So for example, schizophrenia, paranoia, autism, ADHD, etc.
Yeah, very good question that I didn't mention. So I focused on prevention, but yes. What happens with mindfulness is it's an element within an intervention. So many, you may have heard this term mindfulness-based. So that means that the intervention of the program or the program is using a lot of mindfulness exercises, but doesn't just have that. And clinical interventions usually have some sort of psychological treatment and mindfulness. And mindfulness can be there at different levels. It can be based on mindfulness, or it can have an element of mindfulness, but not necessarily based on it. So MBCT is mindfulness-based cognitive therapy, but then you have acceptance and commitment therapy, which is a different kind of flavor with a bit less mindfulness in it. And now there's a big range of those interventions, and they are targeted to different mental health problems. For some of them, there is really good evidence. Like for instance, for MBCT, one of the oldest clinical interventions incorporating mindfulness, there's really good trials out there, and the NHS actually incorporated MBCT as one of the treatments for certain types and durations of depression, basically. So yes, there are, and mindfulness can be effective, but it's very disorder specific in a way, and people are being careful with that, because when you get to the clinical side of things, there is more regulation, and because the risks are higher, there is also more care around, what's happening with these participants when they're taking part. The thing is, so that all that care is not really being translated in the prevention aspect of mindfulness. So when you go to the preventative mindfulness courses, it's more of a jungle, really. Like different providers offer different things. People are not necessarily being taken care of, and really we know much less about what's happening out there. Yeah, thank you.
Thank you. Going back to the student study, you mentioned that the mindfulness intervention helped students during exams to manage their stress. Do you think that being part of the study influenced the result by reminding or encouraging participants to use mindfulness during the exam period? Or is it something that they just did out of their own will?
Yeah, definitely. Always. Being part of a study is a great reminder in itself. Also, because the study was a high visibility study. Because this was from the officials of Cambridge University actually promoting the study, so it was high visibility, and people were reminded that they were in the study. We really wanted to minimize the influence of being in the study. But on the other hand, being high visibility helped us to recruit, and that was the main thing. Also, in a way, being in the study, will help people to practice, but also the course itself tries to remind people to keep on practicing. So it's not just being in the study.
Thank you. Question for you and the research team: do you practice meditation regularly, either alone or as a team? And if not, why not?
Nah. Good. Okay, so in the team, some of us practice and some of us don't, and they don't practice at all. And why not? Well, it depends on each person, but on the whole, what I feel is really important is that we're a mix, because that adds a lot of perspective to the study. So when you do a research study, one of the things you don't want is bias, and bias is unconscious, conscious and unconscious. So let's say you practice and then you run a study, and because meditation or mindfulness has been really beneficial for you. So although you try not to influence the results, you may influence the results, or at least you may perhaps not see some things. You may be kind of blind to some perspectives and things that perhaps you don't measure adverse effects because you haven't had any adverse effects. Perhaps you see this sort of thing. So it helps that the team has a variety of experiences around that. It really helps for that. So I think that was the best aspect of it, and I would prefer always to work in a diverse team in that sense. Yeah, thank you.
Thank you. You talk about bias, because some of this research might be quite subjective. What percentage bias is typical for these kinds of things?
So bias, it's a huge topic. We try to minimize bias. And for instance, when I was talking about randomization, that's one of the ways of minimizing bias. I would say one of the best ever ways of minimizing bias that science has come up with. But even with that design, randomizing people to treatments, there are some that will creep in, and it's actually, that is one of the biggest problems, that bias is very difficult to quantify. So we can quantify uncertainty, and we have statistics for that, and that has been very, very useful in the history of science. But bias, there are some biases that because they are unknown. Like, for instance, the reason why someone will not answer a questionnaire. So I showed you that that for instance, for a 1-year follow-up questionnaire, we only have just above 50% response rates. What happens with the people who are not replying? So when we analyze them, should we assume that actually they were feeling worse and that's why they didn't reply, or should we assume that they just forgot, or they were not interested but they were feeling as well as the others? So we have no idea, and there's no way we can minimize that. We can use some methods. We use multiple imputation, which is a method to try and guess and educate it and guess about what those people would have felt. And then you can do sensitivity analysis, which is assume that they were worse and see what happens if they are worse. What would happen to the results? Would they change if they were actually feeling worse? How much worse? But you really don't know. That's the big problem of bias. Yeah.
Thank you. I think we have time for one more question. Sorry that we couldn't get to them all. They've all been really interesting. Have you looked at the correlation with physical metrics like fMRI or skin conductivity, as well as a qualitative survey?
Yeah, we did a bit of that, and I didn't have time to show those results. But with 50 people, we actually measured some biomarkers in the blood, and they were related with inflammation and immunity. But what we wanted to see is whether mindfulness with, perhaps you heard that with psychological distress, there's this idea that the level of pro-inflammatory molecules in your body will go up. So inflammation, so that the body will have a higher tendency for inflammation in the tissues. And that is a marker for problems later on, like physical health problems and even mental health problems. And so we wanted to see whether mindfulness would buffer the inflammation that the stress of the exams would generate. And we didn't really find evidence for that. We couldn't see, but this was a pilot study, just 50 people. It's very expensive to do this. We did immunophenotyping, a very time-consuming and an expensive way of analyzing lots of molecules in the immune system. And we didn't see any large effects, and this is an interesting area of research. More should be done, certainly. But yeah, that's as far as we could get. We really didn't have more funds or time to do more. Yeah.
Thank you so much, Julieta. It's been really, really interesting to hear your research and all those questions. Thank you, everyone, for engaging so well. I'm going to pass over to Harriet now to wrap up.
Hey everyone, thank you so much for coming, and thank you to Dr. Julieta. I know I really enjoyed listening to all of that. Yeah, give you a big virtual round of applause. Yeah, so I just wanted to come on quickly and just say a big thank you from Mindfulness After Cam. So Mindfulness After Cam is a group for alumni and their friends and family who have an interest in mindfulness. And it's run by me, Corinne, and Isabel. At the moment, Isabel is unfortunately leaving us, but we have got some new members coming. Yeah, so I just wanted to tell you a little bit about Mindfulness After Cam and tell you about what we do. So we have like a variety of things that we have. We have a calendar that's collating mindfulness events from across the internet. That's Corinne's sort of area. She's really good at kind of bringing all of that together. We have a weekly bulletin for mindfulness updates that comes out on a Sunday morning, which is really nice. There's a blog which we ask for anyone to contribute to if anyone wants to talk about mindfulness or have a chat about the kind of things that they're thinking about mindfulness. We have a Facebook group and a Facebook page, which is really trying to get the community together. And one of our biggest things that we do is we have a lot of events and talks, weekly meditation sessions. These weekly meditation sessions are run by a couple of mindfulness practitioners that we have with us. Most of them are Cambridge University alumni, which is really nice. So yeah, these events we host and we advertise in our weekly bulletins, and we would love for as many people to come along to any that they can, which yeah, would really be great. The thing that we've got coming up soon, which you might all be interested in, is we have a 4-week course coming up with Dr. Elizabeth English, which is going to be similar to the 8-week course that Dr. Julieta was talking about in her study. So if you guys were interested in yeah, thinking about what did those students partake in, it's similar. We'll be hosting a similar 4-week event for you to join and get involved with. It's going to be a really, really great 4 weeks, and we really hope that we get as many people coming as possible. I have sent in the chat box underneath, there's links there to everything. So we have our link to our mailing list, we've got our Facebook group. There's also in there a link to a form where you can register your interest into the 4-week course. So yeah, do register your interest, and we'll send you an email just kind of saying how you can get involved and how you can can join in. We do have a session now, well, in 10 minutes, with Dr. Elizabeth English, which will kind of be similar to what you'll be doing in the 4-week course. So yeah, I do really encourage you all to come along and kind of, it's a really nice follow-up from Dr. Julieta's talk that we've just listened to. So yeah, I sent the Zoom link in the chat as well. So if you don't have it, yeah, it's in there now. And yeah, hopefully we'll see you all in 10 minutes. Time to go and make a quick cup of tea. And yeah, thank you so much for coming. And thank you so much to Dr. Julieta. I know I loved your talk and I think everyone else will too.
Thank you. Thank you everyone for listening. Bye.